on the Cario mode, the wavelength is 450 nanometers. And what it does is it detects structural changes in the dentinal tubules. So here you can see between the daylight mode on top that there's obviously some slight staining in the pits and fissures, but when you switch it to the Cario mode, the evidence becomes clearer, and the red indicates that there's a suspicious area or a cavity. If you're concerned, you can then do a whether this is a false positive, you just have to go in and do a professional cleaning, and if it still shows up, you know that it is definitely needing to be treated. So don't you agree that this technology, along with our the way that we typically have collected data, could be at the difference between the patient really being able to identify their disease level and own it? So just to recap on the 3 Ps, we are preparing the patient for what we're doing. Then the second P is the probing or the perio charting. And then the third P is the presentation of the treatment plan and the disease level that they have. I then take the intraoral camera, the SOPROCARE, and I am taking some images of the inflammation and possibly any suspicious lesions that I may see, so that the doctor can have these during their exam. Now, the other great thing about this camera is that there's no buttons to switch and push and to fumble with. There is a toggle. It's just a simple toggle that switches between this. The other thing about this camera that I love is that you can do a full face view, so no more external cameras with all of the lenses and all the cheek, you still use the cheek retractors and things, but you don't have this big camera with all these settings on it. You take this camera at the at one level and take a full face. You can take a half arch at a time, full mouth bites, and then you can switch it to this close-up view. It has a little guide that goes with it so that you have a steady hand and you can just slide it, rest it on the teeth. It's autoclavable, and that little sleeve fits over the end of the camera, and you just rest it on the tooth and you slide it as you're taking the images. There's also a foot pedal that you can push if you want, or there's a little hand control if you have an assistant that can help you with that.